Well, hello everybody. My name is Gary Lucas. I'll be your primary instructor for the 2017 Rural and Community Health, Clinical Documentation, and Coding Self-Study video modules. I'd like to take the opportunity to say thank you for the time that you're going to dedicate to this course. And what I'd like to do is kind of walk you through real quick some course navigation and course information that will be absolutely vital for you to maximize your educational experience. You probably already noticed something a little bit different in that you're going to be able to see me for the majority of the class, and then over here be able to see what's on my class slides. Occasionally we're going to jump out and look at some external resources. But, in essence, what I'd like to do is kind of help you organize your thoughts because this is a self-study class, not a traditional lecture where we're going to teach everything you need to know. What we're actually going to be doing is asking you to go download some information, print the class slides, go read your CPTs, go do some research with Medicare, and then join us back for each of these modules where we'll discuss together what we hope you got out of that chapter. And then we'll continue to make sure that you know how to keep track of the changes as they occur, because you may have just started in this industry, or heck, you may have been doing it a long time. As you well know, the moment you get it down, it changes. And so survival in this industry doesn't always equal success. Rather, the individual or the organization that shows that they have a process for keeping up with the changes, and most importantly, figuring out how to get everybody to work together, to receive the same type of training around the documentation creation process, the professional coding process that is often not given enough attention, and then, of course, how we turn that into a proper bill. So the basic rundown of the course is down here. And what you'll notice is that the course organization, of course, is where we're starting. And each of the first couple modules are very important to kind of set the foundation for really getting into our books and really getting into our manuals. So we'll first, in Module 1, separate the clinical documentation process from coding and billing. We'll then move into a review of the most important books and manuals, of course, like your CPT and other books you're going to need to have access to. And then we'll move into evaluation and management, where we'll break down the difference in the CPT versus Medicare's documentation guidelines, why documentation guidelines might be different depending upon who you're reporting services to. But then how do you get into preventive service codes and your G codes for the common preventive services performed in either a rural health clinic or an FQHC. When we say FQHC, Federally Qualified Health Center, and you'll hear us use the terms FQHC and Community Health Center kind of interchangeably. We then move to what's called the surgical package, global billing, bundling, and modifier usage. And even though you don't consider yourselves surgeons, a quick little hint is that any of the CPT codes that begin 1, 2, 3, 4, 5, and 6 may apply. Then we're going to kind of finish the review of some of the procedural services you might perform based on what we'll call the qualifying visit lists. They're going to be a little different for rural health than they are for community health, just like radiology, path and lab, and then your medicine chapters. And although you'll see a reference here to HCPCS Level 2 codes being provided in Module 5, quite honestly, folks, we're going to be talking about them for the entire class. So although you see it listed here, make sure you have your HCPCS book available throughout the entire course, because in Module 5, we'll just revisit some of the codes and code sections we think you should look at. Then, of course, the last module is review of what are called the official guidelines for coding and reporting in that international classification of diseases, where, believe it or not, we'll clarify and shatter some of these myths that we actually started the ICD-10 in the United States in 1998. Because there's a difference in the ICD-10 versus the ICD-10-CM, which is the clinical modification and diagnosis book that we use. But there's an ICD-10, there's an ICD-10-CM, and one that facilities use that we won't really encounter in rural health clinics or community health centers. But it's the ICD-10-PCS, and the P stands for Procedural Coding System. So we're going to go into your manuals, and really one of the themes we're going to share with you is how important it is to have access to your physical manuals, folks. There are limitations in software. There's limitations in encoder software, which are the electronic versions of these books, We'll elaborate on that in more detail when we go through. But folks, believe me, the moment that they make wonderful digital versions of these books is the day I'll stop carrying them around. And I've been carrying these things around for almost 2.5 decades. At the end of that, the module will go in and give you some closing remarks and wrap up and identify what's next. What we hope many of you follow this coding and documentation course with is our specific billing webinars for RHCs, rural health clinics, and for FQHCs. Both rural health clinics and community health centers can take the same documentation and coding course. But your billing webinars are different for FQHCs than they are for rural health centers, just like those of you that choose to take our optional certification exam to become either a rural health coding and billing specialist or a community health coding and billing specialist. You'll need to make sure that you take not only this course, but the appropriate billing webinars, and then of course the tests will be a little bit different. So here's my contact information, folks. We're based here out of Metro Atlanta. I've got a, let's say down here, Master's of Science in Health Informatics from the University of Illinois, Chicago. I'm a CPC, Certified Professional Coder, Certified Professional Coder Instructor, and an AHIMA ICD-10 Ambassador. And my primary role with the Association for Rural Health Professional Coding is as Vice President of Education Operations, not only teaching courses like this with my colleagues, but assisting of the continuing growth of the only organization that's out there to support documentation, coding, and billing specific to your unique facilities in rural health and in community health. So there's my contact information. Here are my primary colleagues. You may recognize some of their faces. You may have met them, some of them or myself out there while we're teaching across the country. You have John Beard, who's the CEO and founder of the organization, Miss Julia Scott, who is the director of our member services area, and then John Burns, who many of you may have met as well, who's actually going to be teaching a couple little mini webinars tucked inside the presentations that we're going to give you a little fresh face, a little fresh voice and perspective. And we wanted to make sure that you were aware of who they were and what we can do if we can further help you. Of course, just like on the car commercials, when you think you're getting a free car and then they give you the little short, small print and say things real fast at the end of the commercial. I do want to start out by pointing out that in order for you to get to this point in these videos, you had to accept a disclaimer and some terms and conditions that confirm that while we encourage you to use some of the physical PowerPoint slides to help train your colleagues in your organization, I mean, we urge you to make notes and highlights to share with your colleagues. Your access to these videos is unique to just you, and anybody else in your organization that needs access to these should get their own access so that we can track it for continuing education and to track the prerequisites to open up the options to take the billing webinars or the certification exams that are optional. And so all the content here is owned by the Association for Rural Health Professional Coding. But notice the second item down here that's really clarifying. I know it seems weird here, but folks, I hate to say it this way, but don't believe anything we say unless you can verify it for yourself. So we're here to educate and provide training. I mean, heck, after all, the kind of the motto of our organization is education, certification, and audit support. And we're going to help be hopefully a part of that ongoing process for you. But you remain ultimately responsible for proper documentation, for proper coding, whether you're giving that information to your patients, whether you're giving it to an insurance company, whether you're reporting it to the Vaccines for Children program or a cancer registry, or for public health requirements, or even for quality measurement or utilization review incentive payments. You maintain responsibility. But what we're going to be very careful with and what we pay a lot of attention to is making sure we give you the sources of the information. So for example, we're not going to teach from fear here, but there's some scary things we'll be talking about, like, hey, please don't submit a claim to Medicaid or Medicare without closing your note, without making sure your note is closed and signed. That would be a violation of the False Claims Act. Now, some of your electronic systems might prevent things like that from happening, but again, we can't give credit to or blame to any of these systems. It is ultimately us that's responsible as clinics and facilities to report things correctly. So we'll be very careful, as you see down here, to include the resource manuals. And folks, at the end of this, you're going to probably have a pretty thick binder of all this information. Before I get started, you're going to see me occasionally hold up the CPT, and I can't stress how important it is to have a version of this every single year. We recommend the professional edition, which has a spiral binding and it has some pictures. Okay. The standard edition is fine. That has a flat binding, and we may even talk a little later about the digital version of the CPT, but the CPT, the letters, the code numbers, the code definitions, and especially these guidelines that appear in between the codes are 100% and fully owned by the American Medical Association, and we want to make sure we make the appropriate attribution for them. They own the definitions, they own the code numbers, and I'll tell you that the paragraphs that sometimes are in between some of these codes are rarely, if ever, licensed to other organizations outside of the AMA and can only be found in your books. The HCPCS Level 2 code book we'll kind of share with you as we move forward can be from just about any publisher. Same thing with your ICD-10s, but we think you should be extremely cognizant of the benefits of having the AMA CPT, and of course they own this information cover to cover. Now, for those of you that are in rural health, pretty clear that our name serves you. However, we are creating our new logo coming up soon for the Association for Community Health Professional Coding. And as I mentioned, we're going to have FQHCs, or Federally Qualified Health Centers, and community health centers is kind of the same term. Although you are legally designated as an FQHC, I doubt that's on the sign outside of your clinic. It probably says you're a community health center or a primary health or primary care center. But the legal designation of being an independent rural health clinic or a provider-based rural health clinic versus an FQHC, or what's called an FQHC lookalike, we're assuming you've already gone through those processes to be legally designated as one of those facilities. And we wanted to make sure you're aware of our dedication to both the rural and community health center worlds out there. So here are a little bit of disclaimers. You'll see some of the information on the other slide, and we'll make sure to point out that you always need to identify if there have been any updates. All efforts were taken, all reasonable efforts were taken to make sure that the information and resources we provide you are up to date. But heck, folks, we could finish filming today, and these guidelines may have been updated, and we'll help share with you the system that you might use to keep yourself updated. So, little information here, and we'll get you ready to move into the modules. Just a confirmation that we are the leaders of this type of education for those focused just on rural health and community health. We also deal with public health departments and school-based health centers. Honestly, folks, our focus is on those of you, whoops, got to go back here. Our focus is on those of you that if you weren't there and you weren't physically or in financial successful shape to provide that care, the patients might not have anywhere to go. So that's what we're here for. We have a passion for supporting you. And we encourage many of you to go get certified. We say kind of learn more to earn more. Raise your hand out there if any of you deserve a raise. Okay, good. We hope that some of these certifications can become very beneficial to you. And if you'll go to our website at ruralhealthcoding.com, click on the certification option. It'll give you a little bit more background about that optional certification exam and where we're going to be providing ongoing training. Heck, you can go buy more e-learning and receive audit consulting services that we provide as well. But this is the nation's only certification and organization dedicated to you. Although we're based out of Metro Atlanta, we have colleagues, primary and secondary staff spread across the country. We're in Metro Atlanta, but between, heck, even just myself and John Burns and John Beard, let alone our other instructors and other faculty, we've provided face-to-face services since the mid-90s in all 50 states. Heck, I've even worked with the Department of Defense in Iceland on a naval base to do some consulting and training, and I know John Burns has done the same in Germany. Folks, we've gone all over. And we look forward to the chance to provide this information via webinar, and hopefully it's a little interactive and different than the standard and normal watch a screen share and listen to somebody's voice. We'll hopefully keep it a little interactive. This is a little map, just as a little side note. If you recognize my face, it's probably because I've been in your area. This is a map I haven't updated in probably 5 or 6 years, and just gives you a little idea about where I've traveled. So if you're listening to one of my sessions here, you may hear me tell you that, okay, we've heard such and such, or these ideas, or we've seen some mistakes happen in some clinics, and it comes from all the people underneath these dots, folks. Nothing's ever going to replace face-to-face training, but we hope this is viable, especially for those of you that might be somewhere where we're not going to get out or get close to you. So I've had the chance to teach in 46 states, about 1,600 workshops. I've traveled in 49, but I've been to 46. And again, we've got you covered. So we have a pretty diverse audience. You'll notice that we serve these facilities over here. But one of the things you might want to notice nicely is that what we're going to do, different than what a lot of other organizations do, is we're going to cut out the stuff you're never going to perform in a rural health clinic or an FQHC. We're not going to review anesthesia. We're not doing radiation oncology. We're not doing cardiac caths or interventional radiology, and it's really important to recognize that we're trying to keep this honed in and focused on what you deal with on a day-to-day basis. So we look forward to the chance to do this, and we encourage you to continue to go get other certifications like CPC and your CCS, and from a lot of different organizations. We find it valuable. We think that our certifications should supplement others that are out there. And you might have seen our little phrase, learn more to earn more. Folks, we hope you get so many certifications, your business cards are this wide. So we welcome you and hope that this is going to be beneficial for you. As far as who should be attending or maybe getting this information, folks, everybody on this list needs some amount of information. Obviously, coders and billers need this, but it's been kind of the holy grail in the education industry for us to get this information to your clinical providers. You see, your clinical providers, they don't treat codes, they treat patients. But with the continued increase of IT into the medical world, whether it's through EHRs or different reimbursement systems, they do need to go back and hopefully get background information on how to document in the medical record. On how sometimes the CPT will give you guidance on how to document, but Medicare might want it different. But what about Medicaid? What about our commercial insurance companies and managed care? They might want it differently. So this is something that's going to be very beneficial to them. And heck, you may just be implementing the EHRs and you might be on the IT side of things. And you'll hear us occasionally in the documentation portion of this class talk about it may not just be that you document something. It may be where you document it. So for example, we'll talk about super bills and encounter forms. Well, you could write down on that super bill or encounter form, return to clinic, continue meds as previously ordered, and refer for an EEG. Well, that's very valuable information that should be in the medical record. Will help your providers get credit for everything they're doing in what's called medical decision making. But if it's only written on your super bill, whether that's a paper super bill or the electronic version of it, things like remembering that that's not medical records documentation is important. So your IT and EHR folks might need to help with screen designs and the creation and updating of those encounter forms and super bills, or quick tips or favorite lists your providers are using. Because quick tips and quick little hit and favorites lists are great, but how do your providers go review codes that are not on their favorites list? Or are they just selecting those if they're close? So if you're a clinic manager or a financial leader, you might not be doing coding on a day-to-day basis, but you're making hiring decisions. You're choosing which IT systems are out there and trying to figure out how they integrate together. We want to make sure you're making hiring decisions on people that have relevant, accurate, and timely knowledge of the unique nature of rural health clinics and community health centers that might be different than the traditional medical world. And especially those hospitals that are buying rural health clinics and so forth, you've noticed it's a brand new world out there that the billing side of things can be considerably different. So the process is anybody involved in creating documentation, turning that into the CPT codes and HCPCS codes of what you did, and turning that into the ICD-10 codes that describe why you did it, turning that into whoever reports those services, whether that's to an insurance company for payment, or to a vaccine or Part D carrier about what vaccines you might have used, we want you to make sure you go back and just like you tell your patients to get preventive health services, we want you to do preventive visits on yourself. Although we do a lot of audits for organizations, our job is to help empower you to do your own internal audit so you can give your providers and you can give your clinics a periodic health check. And base your education on what you found in those audits, and folks, repeat as necessary. It's kind of the shampoo model of education here, folks. Get yourself trained, continue education, and repeat as necessary. So here's our website where you can go get information, whether it's the bookstore or when we're going to be in your area. But do notice that where you logged in to receive this training is different than our member center, where you may be keeping track of your membership, ordering books, tracking your CEUs and things like that. Notice that they are two different systems that may require a different username and a different password for each system. We like to kind of keep them separate. So in addition to this, of course, in our e-learning center, if you need CEUs, we've got a lot of low-cost CEUs out there to maintain ongoing education. We'll let you look at that on your own. But I guess out of this slide, what I might want you to do is be prepared, as we'll say here in a couple minutes, to use your pause button. If I happen to go fast or go forward too quickly, please use the timer at the bottom. If you hover your mouse over the bottom of the screen, you should be able to drag and pull it backwards a little bit. You may want to pause something to review and read this slide. But the idea is that you notice that you couldn't access Module 1 until you completed this course information and navigation module. So they've got to be completed in order, and what I like to do is give you a little bit of detail on what you need to do before each video module. So before each video module is launched, before you launch the video over here, what you want to do is make sure you go to the Resources button to receive access to the slides, for example, the PowerPoint slides. Maybe to some hyperlinks or bookmarks that you want to create to external areas or external websites like Medicare to get access to it. Or you might just want to go ahead and download those files onto your computer. So if you haven't done so already now, go review what resources were available for you to get this module kick-started. And notice that because it's a self-study class, you're doing most of the work in between the video modules. I mean, these video modules will run for several hours, but we think you'll at least double that by going to review, read, document, and even just sometimes go in and make highlights in your book before we chat together. So make sure you've added that and that you've done that, folks, because that's going to help you maximize your educational value. If you are printing your slides, of course, try to make sure that some of these slides are pretty big. If you're going to print the slides, try to maybe download, print 2 slides per page, using the front and back of the page to help save some paper and help save some ink. Printing in black and white should be fine. Maybe you just want to download the slides or download the documents. But if so, make sure when you open them, you can open them to an area where you can add notes. Most folks tend to like to print the PowerPoint slides so you can make physical notes, make some of the highlights that you're going to see me make, but then some of the relevant Medicare documents, instead of printing them out like I've done here and printing some of the Medicare manuals out, maybe you go download those. We'll give you some tips on how to organize your desktop right now. So we're simply going to review, of course, like I said, what we've talked about or what we asked you to do in the self-study. For example, you might need to go look at the 9 pages in the CPT that tell you a little bit about how to select things like level of service for evaluation and management. And the CPT has about 10 pages in this. Medicare has about 80 to 90 pages that go a heck of a lot more detail to supplement those. Those are the things we're going to ask you to review, highlight, and study prior to coming back to the video modules. So reading, studying, and highlighting beforehand is going to help reinforce the things that you already know. You might actually find some things in writing that you already were aware of, but may not have been aware with where that information was located. That's pretty darn valuable. I guarantee you there are some of you that are experienced enough and knowledgeable enough to actually teach this class, and you just may be looking for continuing education or want to get ready to get certified and put some more initials behind your name. But I want to share with you that even if we don't teach you a thing in several hours of video modules, if we reinforce what you already know and help you find where these guidelines are so you can share with others, then we're going to hopefully find out that there's a lot of educational value for you. So we're going to be giving you a ton of external hyperlinks so that you can track and keep up with these changes as they move. And as I mentioned before, please always make sure to check for updated versions. And anytime you exit the screen, make sure to notice where you left off or close out of that video window to know where you started. Keep in mind, by the way, if you're looking at this on your computer right now, these videos will run on your phone. These videos will run on your tablet. So you can take this stuff wherever you are. That's one of the things we wanted to do, is give you access to the best information when you need it, where you need it, and how you need it. And we want to make sure you have the chance to do that. Some of you may go ahead and choose to go buy a little 3-ring binder to put your course slides in, to put your mini webinar slides, or even the self-study materials. If you actually print everything out that we're recommending, it's going to be a pretty thick binder. Some of the documents will tell you when they're 250 pages and you probably just want to download a version on your desktop. But your self-study binder is going to be beneficial because sometimes when you actually make a note, you're going to retain that longer than if you just heard something or if you just said it yourself. So you might want to keep a blank page in that binder for a glossary, because we're going to give a lot of acronyms and abbreviations. That's what the world of coding and billing is. Maybe you're going to keep a list of items that you want to go back and review with your clinical providers or your managers or your colleagues or your IT staff. Because we're going to be throwing a lot of these out there, we highly recommend you have an area in your binder to jot them down as you move through. Because I don't know if you're like me, folks, but if I had a bunch of information and I had a bunch of slides printed and I made a note on page 27 or on page 89, I may never see that note again. So consider adding that information there. So here are the areas that we're going to encourage you to think about or maybe make notes on in your binders or on the side. Who else in my facility needs to know blank? I'm going to give you a list of to-dos. Hey, go check and see if your EHR does this or does your EHR do that. What areas are we going to need additional research on? I mean, as an example, this course is not going to teach you how to fill out what's called a cost report, your annual cost report that actually has the most impact on raising or lowering your all-inclusive rate, your daily per diem rate if you're a rural health clinic, or your PPS rate if you're an FQHC. We'll give you access to those resources. We'll give you areas where you're going to have to need to do that research. But what other areas of ongoing research do I need to let my clinical providers about? And how can we improve how we're moving information from one part of our clinic to the other? So one of the things we want you to do, as we mentioned, is whatever your favorite browser is, whether it's Apple Safari or Google Chrome or Firefox or Microsoft Edge or whatever, is at this point, go ahead and maybe pause or stop and who knows, open up another window and go ahead and create a new folder titled the ARHPC, Association for Rural Health Professional Coding, or ACHPC, Association for Community Health Professional Coding, something like bookmarks or research folders. So you can create that link to the helpful information out there, whether it's Medicare's site, whether it's our website, or maybe a public or a private site. In this case, HRSA or Health and Human Services or something. We're going to have a heck of a nice list of things for you to be able to keep track of because there's really not one central repository for where this information is located. We're hopefully going to help you do that throughout this course. On your desktop also, you may want to go put a specific folder together called the ARHPC if you're in rural health, or if you're in community health, ACHPC of Association for Community Health Professional Coding, self-study documents. Now, you know, there's one preventive medicine document out there that's like 240 something pages. Probably don't want to print that one, but there's going to be a lot of information in there. So what you want to do is make sure when you download it, if you ever double click on it, if it's a PDF and you have an Adobe Reader or another third-party vendor that helps you open and read PDFs, use the Control F option or use the Apple F option to find keywords so you don't have to scan 249 pages of documents just to find information on the annual wellness visits. You can use that little feature to get yourself helped out. So make sure that you realize that you will not have slides if you're going to print the class slides here for every single slide that you see that I have. I add some in here that are not necessary for the educational piece, but to keep this video cohesive and moving forward, we're only giving you the essentials. So you will not see me mention page numbers or slide numbers, but remember they will be broken into different modules. We hope that this approach of seeing me and then seeing the computer screen on the bottom is beneficial. But as I pointed out, occasionally you're going to see me jump out here. Whoops. You're going to see me jump out here and go review some information that's going to actually be on the internet. Maybe I'm going to go over here and show you some preventive service codes in a document that Medicare created. We might teach you how to go use Medicare's lookup tool for the correct coding initiative, or access the Rural Health and Federally Qualified Health Center Chapter 13 guidelines so that you might have information on how to report multiple visits on the same day. So we hope that this approach is unique enough to allow you maybe a little different approach and to keep this a bit more interesting. So when you're going through there, make sure you know that you're going to be looking at it this way, and keep in mind I might be switching occasionally between my screen and so forth. And by the way, we're going to try to keep this a little bit friendly. We'll keep it a little happy, and heck, we're going to have a little bit of fun with it. So for example, let me show you something. We have a studio cat. So you might even hear the studio cat meow in the background a little bit, not just to make you say, "Aw," but because it kind of helps the creative process. So we'll have a little bit of fun in doing this. It is strongly recommended that you have your 2017 manuals with you. Already this year, folks, I've seen 2013, 14, 15, and 16 manuals brought to class. No wonder these facilities are having issues. Documentation guidelines change, bundling rules change, and you have to have the current edition of the books. Again, they simply do not contain, your electronic versions simply do not contain the same information. There's no other way to say it. So when you're looking through here, essentially any publisher's HCPCS Level 2 code book and your ICD-10s work well. But remember, this is a clinical documentation and coding class, and we'll find that relevant information in these manuals. But how to turn those codes into compliant medical bills might be different. Coding is a very scientific process. Billing is a very artistic process. And while we would never change the quality of care that we provide our patients based on whether or how we're going to get paid, it is true that the patient's bills might look different. But from a coding perspective, everything should remain exactly the same. Now we're going to touch on, and we have to build that bridge occasionally to talk about billing items, but the primary focus of this course is on documentation and coding. We hope you follow this up with the billing webinars that we teach. And there's a lot of other state and national organizations out there that we'll share with you that you can use to get additional information as well. So we hope that you're able to combine this with the billing webinars, and heck, maybe even take that certification exam. So last couple items here is, once you complete each video module, make sure that the videos run all the way to the very end. And at that point, you're going to want to go access the practice modules or practice quizzes or review exercises so you can get a little practice. So again, make sure you've watched the full video. And then realize that the review exercises aren't graded. We're going to give you 1 or 2 chances to answer each question. If you don't happen to get it right, we're going to show you the right answer. We're going to provide you with the rationale on why that's the answer. And more importantly, tell you what reference material or resources we used to get to that answer. So they're not graded, but they're going to help identify if you retained or accessed the knowledge we were looking for there. And again, until you complete those review exercises, it will not unlock the next video module. So again, the course does need to be completed in order. And folks, I talk for a living, been doing so a long time. We don't take a lot of breaks between subjects. I just keep on rolling. I'll do my best to make sure to give you enough time to read each slide, but I'm telling you right now, your pause button is going to be your best friend. It's a very interactive course. We're going to be bouncing around between several pieces of information. And so this is how your desktop should probably be organized. I mean, your literal workspace. You're going to need to have each of your coding manuals available. And then your self-study documents might need to be available for you. your slides. Again, most people like to print the slides, but maybe have a lot of the other documents on their computer. And then, of course, you're going to have this self-study or module there. So you may want to open another window for these videos to be able to keep another window open to access some of these self-study documents. And, of course, we're oftentimes going to have you pause, stop, go read your books or regulations. If you didn't happen to highlight the key words we're pointing out, that would be the time to do it. Go back in your slides and make your notes, and then we move forward. So, last reminders here, it's documentation and coding. There are optional billing courses and certification exams out there. And then we can get into the very end on the course wrap-up module, but it's essentially a 100-question examination split between documentation, coding, and billing to become a rural health or community health coding and billing specialist for those of you that might want that. And then, of course, we hope that we can meet you because we go where everybody else flies over, folks. We go to your rural health communities. We go to your federally qualified health centers. We work with your state associations and with national associations to get this information to you since nobody else really does it the way we do. So go to that member center to get the training calendar. And remember, that coding is coding regardless of the type of facility. You won't find a lot of information in these manuals that specifically say rural health or FQHC. I mean, coding is coding. Documentation is documentation. But Medicare has their rules. Medicare Managed Care has their rules. One of the things we're going to ask you to go get is which insurance companies do you participate with, and do you have access to those participation contracts to get some key questions answered? So we're going to move you back and forth between these books, and we're going to assume that when we call, instead of saying the word physician, when we say provider, we mean MD, DO, PA, NP, social worker, psychologist, somebody authorized in the state to provide care in that already certified RH-C or FQHC, and that provider is the term we'll use interchangeably, even though sometimes the books say physician or other qualified health professional. We're going to use the term providers interchangeably. And realize that the patient's financial responsibilities sometimes might change depending upon where they go. Bottom line, folks, patient goes to a traditional Part B medical office, they're going to owe basically 20% of the allowed amount for those services. Patients come to a rural health clinic, they're going to basically owe 20% of the charges for each service on the claim. If they go to an FQHC, they're going to maybe owe 20% of what's called the PPS rate. Even if they got the exact same service at each of these locations. All these facilities have to document the same. The coding is going to be the same, but you better believe that bill is going to look different. We're going to get paid differently, and the patient owes a different amount of money. So keep these in mind if you're working towards that billing webinar. That once you get the coding and documentation down, all you need to know is about 38 pages of these guidelines and about 49 pages of these. You see, these are two very key documents that will help build that bridge between the documentation and the coding portion. And if you've done like I've done and gone through these manuals, you'll notice that both rural and FQHCs are grouped together by Medicare. We want to make sure you have access to those. But just as a quick stop, these are the documents you're going to want to look at before you take the billing webinars because they're two of the major documents to outline some of the billing rules. So last but not least, please avoid the natural and understandable tendency to skip ahead to billing education without making sure we've coded it correctly. Because as you'll see, we might have done 5 services, but maybe only 3 go on the claim form. Did your facility capture that all 5 were done? Do we have the documentation to support what we reported and what we billed for? And so that's going to be our focus. We welcome you here. So the module separating clinical documentation, you might want to pause and take a quick read about what's discussed. You want to look at key principles of clinical documentation and coding? Please pause now, review your slide. Same thing for evaluation and management documentation. You'll notice that one of the things we're not going to do is read bullets to you and read slides to you. What we're really going to do is carry on a conversation today. Each of these guidelines will be reviewed. Each module will contain the benefits of that section. We'll summarize everything we talked about. But if you wanted a quick idea about what we're going to talk about and when we're going to talk about it, Please consider pausing the video now to review these items for each of the key modules. Remember, the slides must be completed in order. And as we're moving through some of these, folks, we hope that you find a lot of educational value from the manuals, from the materials, and then we'll highlight what your next educational steps are, how to become certified, and bottom line, welcome to class. Learn more to earn more. Make sure you're aware of what our focus is. Look out for this symbol when billing information might appear. You'll see that logo of ours appear on some slides. Now you've completed the course information and navigation module. Make sure the timer goes all the way to the end so that it unlocks your next video module. Make sure to access the resources and self-study information, because we're not going to be teaching you everything. We're going to be going through what we hope you looked at to get yourself prepared for the next module, Module 1, separating clinical documentation, professional coding, and proper billing. On behalf of John Beard, Julia Scott, John Burns, our other colleagues out there, we welcome you here to class and wish you a good time on your educational journey. Thank you.